The Texas Medical Association's top priority during the 2011 legislative session was to protect the patient-physician relationship in every aspect of the healthcare system. However, when the session ended, medicine scored some important wins for physicians and their patients. Ask any legislator or physician leader about the most challenging issue this session, and the answer is the same.
Dealing with the budget shortfall.
The budget.
The budget.
That's because legislators had to balance a budget with a shortfall of more than $26 billion.
Already.
Initial budget plans slashed physicians, nursing homes, and hospitals' Medicaid payments. TMA argued that not adequately funding Medicaid only drives the cost down to local taxpayers.
We were very concerned about what any cut to the physician payment rate would do to the ultimate network of physicians that would be involved in the Medicaid program.
What happens is those individuals cannot get care when they're sick, even though they have Medicaid insurance.
Lawmakers finally adopted a 2-year budget that trimmed $15 billion in current spending. The good news? Physicians' Medicaid payments were not slashed, nor were state mental health services.
So we were happy that the hardworking doctors taking care of our patients in the rural areas and in the poor areas didn't have their fees cut, and they can continue to do their important work.
I feel that we, in essence, have first done no harm. We would like to be able to say that we're enhancing access to healthcare services, but that we at least have not stepped back from some of the enhancements that we did make in previous sessions, and at least we haven't piled on any more cuts than the ones that were already incurred during this current biennium.
Instead of axing Medicaid services, legislators found savings and efficiencies in Medicaid.
I was looking for ways to do things more efficiently, to make sure that we didn't hurt patients.
One step lawmakers took was to expand Medicaid HMOs to the Rio Grande Valley. TMA worked with legislators to ensure Medicaid HMOs were held more accountable.
We've been able to patchwork together a budget that will allow the Medicaid program to continue to meet the needs of the indigent population in Texas.
The bad news is that many public health services, women's health, and family planning were cut significantly. Undergraduate and graduate medical education also took a huge cut. The cuts hurt family residency and preceptorship programs and physician loan repayment programs.
Each medical school lost almost $20,000 per student in support from the state, and our graduate medical education programs were cut, and some of the programs in Texas are probably going to have to lower the number of residents they have in their program because of that. This to us is devastating. We want to increase graduate medical education in Texas, not decrease it.
And without the residency programs, we lose trained physicians to other states.